Welcome back to Hamilton Life, everyone. So June is Men's Health Month, and I think this is really important because a lot of men don't do anything about their health, and that's a stat, right?
Statistics,
It
yes.
is, Tyler. Like they unless they're told by their partner to go to the doctor or go have something checked out, or I think you should do this, they don't do anything.
They don't, and that was something that has always been my observation. Anybody in healthcare will tell you that. Like, men usually like to not talk about things and just like, you know,
it's all okay.
So their wife will usually, or their girlfriend or somebody, a significant other will say, you know, you should go and get that checked. I'm like, yeah, I'll get to it. Like, they just sort of put it off. So, you know, we have these feelings, anecdotal reports, but I actually looked up some Harvard University studies this morning because I knew that they existed, but I kind of wanted to have some actual stats.
And this is some interesting stuff you found.
Really good stuff. Like, one of the things, just like what we were talking about, women are 3 times more likely to visit medical doctors than men. And 25% of men actually, during these studies, actually reported that they would wait till the last possible minute to see a medical doctor. As in, like, the only way they're going to see a medical doctor is on a stretcher, like from an ambulance.
Which is crazy.
It's just crazy. Like, they don't have any preventative sense.
No, and because of this, like when they are hit with something like disease, heart disease, we'll take a look at heart disease, they're 40%
more likely they die faster.
They die faster because it's probably been caught.
It's been caught too late,
right?
And they also have compounding factors. So men often have more chronic illnesses than women. So, you know, if a woman has heart disease, a man will have heart disease, cancer, and something else.
That's wild.
So they have all these complications and all these medications that they're using to treat those, and all those things, you know, they have their side effects, and it's just a vicious sort of snowball. And men just in general, and this is a worldwide statistic, so it's not just American, they live about 5 years less on average than women.
Yeah, which is interesting. I mean, and when you take a look at that, I mean, I'm sure other factors factor in, but not being as in tune with what's going on in your body and knowing that something's wrong or admitting something is and getting it dealt with, right?
Like, there are specific issues for men, right? Like, you know, there's erectile dysfunction that men worry about a lot, and women have, you know, equivalent sort of issues as well.
Prostate's a big one, right?
Yeah,
like
women,
we often hear that talked about.
Exactly. So a lot of men come in with prostate, either enlarged prostate, which will affect their ability to, like, urinate fully and completely, and they're getting up all throughout the night, or prostate cancer is one that's specific to men.
And if caught early,
it's
treatable,
very manageable,
right?
if caught early. Exactly.
Yeah.
It's just one of those things where they're just, you know, they let it go kind of a thing. And a lot of it, some sort of risk factors I found interesting. So they're twice as likely to develop liver disease, 3 times as likely to develop kidney stones, 5 times as likely to develop aneurysm. And there's a big mental health component that I know mental health is one of those things that's just starting to, like,
thank goodness,
come to light, right? It's
people,
kind of
we're talking about it.
We're talking about it. They're 4 times as likely to commit suicide than women, and 3 times as likely to develop alcoholism.
Wow.
Which are usually, and we work actually with a group of people who are in recovery at our clinic, and a huge majority of those people that have alcoholism are self-medicating. So they have an issue, and they just don't, like we talked about, they don't seek help, and so the easiest thing is...
Well, they don't talk about it.
They don't talk about it.
Men don't talk about it. I mean, and it's not all men, but men, like, I mean, women, we're like, we got a problem, we don't talk about it, we're talking about it, we're talking about it, so we get it out, right? Men just hold it all in.
It's funny that you mentioned that, because social networking is one of the big sort of risk factors that, you know, if you have a big social network and you talk about it a lot, and women do have a bigger social network and talk more, men are just like, you know, you don't get around with your buddies and be like, oh, you know, I had this thing and I got these feelings. Like, that's just the thing.
No.
There are some
eat well,
specific
exercise.
Things. Exactly, and there's, you know, getting enough antioxidants and more vegetables in your diet, and if you don't want to do that, you know, there are really easy things. I know a lot of men are getting into the smoothies, especially when you throw a protein in it. It's like, oh,
then it's a guy's
for my
drink.
muscles.
It's got protein.
So you just throw that in there, and it's like having a salad in with your protein shake. There are specific things for stress management as well, which I think is a big one. Risk factor for men used to be work-related stress, and that still is. But I have a feeling that, you know, with more women entering the workforce, that's not really going to be a men-specific statistic anymore. And in fact, the amount of women coming to us with work-related stress is just crazy, because then they're also parenting,
huge, right? Oh yeah, and the stress, and it trickles down, and then it causes problems and disease and everything else in the body.
So I think that's a big one, and there are things that you can do. It sounds strange that there's a supplement for stress, but there is.
Well, I mean, when you take a look at stress and what the effects it has on the body, it's not a surprise that there's things you can take to try to lower your stress. And then I like this one just because it's called prostate fitness.
Yes, there are things that there are everything from, like, the really simple options, like saw palmetto, which is actually used in parts of Europe conventionally differently, like where they don't have like a a two-tiered system like kind of how we have here. Saw palmetto works in 85% of men at reducing the symptoms of benign enlarged prostate, let's just say, and reducing risks of prostate cancer. And then some other things help with like libido and erectile dysfunction as well.
Which you say a lot of people come in for. They start
that's the only time they come in.
It's the only time they come in when that's not going well. I gotta go have that checked out, and then hopefully you can help them with other issues. Tyler, thank you so much. Full Circle Healthcare and Supplements is where you can go for more information. Lots going on up there at 905-930-7769. FullCircleHealthcare.ca is the website you can go to. And I'm just saying, you hear some of those stats, guys. You might want to start listening to your significant other. Just listen to what we're saying there. Get yourself checked out, and then hopefully you can live a much longer and happier life. Okay.